Here are some introduction to the approach of a victim of aquatic injuries. We introduce to you the 4A approach, which stands for assessment, ask, aid, and assist. Now, we're going to discuss this in detail in the following lectures, but for now, it suffices for us to discuss about this 4 little a which is important for you to remember whenever you approach to any aquatic injury victims or to any victims per se. The first is assessment. Now, during assessment, what you need to do is the first thing before you jump into the water, or once you come across to any situation of emergency, you need to assess the situation. What do you want to look for? Well, there are 6 things important that you need to look for. The first thing is called hazards. What is the hazard surrounds the incident, or the hazard that still present at the scene? 2 is the extra resources that you need. You need to think of asking for help early, or what are the extra things you need to do. The third one is actually in terms of number of victims, because 1 victim or 2 victims or more will basically have different approaches to help them. The next thing is the type of incident. Well, most probably this thing is drowning, but drowning where? And the fourth is actually accessibility, and the fifth is the mechanism of injury, whether it is his head hit against something or he's going to cram and so on and so forth. So in short, it's called HENTAM, H-E-N-T-A-M, for hazards, extra resources, numbers of victims, types of injuries, accessibility to the victims, and the mechanism of injury. Now, during assessment also, you have to make the situation as safe as possible by doing certain things. If someone fall into a pool of water that is basically have some electricity going in, you need to switch off, because you don't want to get electrocuted as you're trying to help the victim. Now, the next A is ask for help. Now, you should shout for help before you go in. That is most important thing. Do not go in then only you think of getting help. So you should shout for help, because if people is not there but people is around or within hearing distance, they will come and try to assist you. Now, you also during asking for help, you should look for equipment or some apparatus that can help you, like rope or some floating devices. And remember to call 999 for ambulance or emergency medical services to help you. The next thing is that after you have done assessment and asked for help, then basically trying to give aid to the victim. Giving aid can be in terms of doing the rescue technique, where you can try to reach out to the victim, or you throw a rope to the victim, or you try to use a boat and get to the victim, or you have to swim out. So these are some of the rescue techniques we're going to show you during this course. Last but not least is assist. Even though the EMS or the ambulance paramedic is already there, try to be a good assistance by providing some of the basic help, like trying to clear up the way, trying to get show the paramedics the way to the injury site and so on, or basically holding the lift if you have to access the area using a lift. So these are some of the basic things that the rescuer can do. Because in the end of the day, what you're trying to do in any aquatic rescue is try to bring yourself, and the victim back to the dry land as safe as possible.